Welcome to She is Resilient, a podcast for women on their healing journeys who are ready to start living their most authentic and empowered lives outside of survival mode. I'm your host, Tatiana, trauma and somatic therapist, as well as a holistic coach, and I'm on a mission to help more women heal their nervous systems. Each week, me and my guests are going to get real and vulnerable about the experiences that led us to becoming the empowered and resilient women we are today. You'll leave this podcast with the skills, knowledge, and inspiration to start creating the life you deserve. Because if another woman can do it, so can you. Carla, why don't you tell us who you are and what you do for a living?
Thank you so much, Tati, for having me on the podcast. It's such an honor. So, my name is Carla Avalos, and I'm a licensed clinical social worker based out of Los Angeles, California. But I'm licensed also in two other states, Florida and Utah. So I'm able to provide telehealth services there. So, about my professional work, my full-time job is that I work in administration for a mental health agency, and I do my private practice part-time, where most of my clientele are like first generation Latinas or males or people of color. Usually most of them is like their first time coming into therapy, or they just want to work on healing like generational trauma, anxiety, life transitions. And I also work with couples, and also a lot of them are either Latino or Latinx, and they're also part of a lot of the couples that I do see, they're also like interracial. Which is also like fun to kind of like dive into the cultural stuff and the different like dynamics. Yeah, so that's a little bit about my work.
I love that. That's amazing. You sound like a very busy woman.
Yeah, I sure am. Yes.
Yeah. So this podcast is all about really sharing our struggles and our healing journey and what led us to become the empowered women we are today. So I'd love to hear a little bit more about you and your healing journey and how that started out for you.
Oh my gosh. So like where to start and how much time do we have now? Yeah. So just a little bit of again, more into like my background. So I am an only child and only daughter of a Salvadoran immigrant mother. She came from El Salvador back in the late 70s, mid 70s. I always get like the timelines mixed. So she met my dad like out here. They have a cordial relationship now, but like her thing was, and now as I talk about it, and also through my own healing journey, I recognize that I think for her, it was just easier for her to make that choice about raising me on her own, only because of her own childhood trauma that she later like shared. So I was, it's always been just me and my mom. We've always had a really, really good like relationship. My dad was in and out of the picture for the most part, but I would say as of now, like we have a cordial relationship. We're respectful, but we're definitely not close. We're definitely not close. And that's something that I've learned like to accept like over the years, that this is how it's going to be. And I've also something that I've also been working on like in therapy through many, many years.
Mhm.
So as a first generation daughter, I always had that ambition and drive to like make sure that I did well like in school, or like in any goal that I set, mainly because I think my mindset was like I wanted to make my mom proud, and also for the fact that I wanted her to recognize that the sacrifice that she did about leaving her homeland and everything that she knew, like it was worth it. At least that was like my mindset, right? So I've always been like a person that really thrives like in schools or just like in educational settings. I've always loved reading, learning. That's still me to this day. If you ask any of my close friends, they would definitely say I'm a person that really, really loves school, loves homework. I'm that type of girl.
Mhm.
Um, I would say that probably like one of like the most significant challenging years that I experienced, like going back like to starting from my childhood, was when I was 15, when I lost like my grandmother. She had been dealing with a lot of like health issues, like throughout the years. And for reference, my grandmother is it was in El Salvador. Um, and I visited her not too often, but enough that when I did visit her, like our visits were always really, really healing for me. Like she was just like a really beautiful person. And the way that she made me feel loved, like that is something that'll always like stay with me. So yeah, so losing her when I was like 15, and I think part of the things that also kind of led me to do like this work is just recognizing that grief in the Latinx community is not really talked about like enough.
Mhm.
So what I mean by that is that when I lost my grandmother, I know that, like I mentioned before, it's always just been me and my mom. Like it's something that it felt very heavy for us for like a while because it's my mom's mom. And also for reference, my mom is the oldest of of five kids. So for her, there was also a lot of responsibility on her. She was growing up, and obviously she was super close like with my grandmother just because she's the oldest. So it was a really difficult time for just because like we knew we were both sad, we knew there was grief, but at the same time we knew that we had to keep going. She had to keep going to work. I had to keep going like to school. We just had to keep going, but not really processing like the deep emotions that were happening with the loss of like my grandmother.
Mhm.
So I just remember that. So from the age of like 15 to like, I guess until I graduated high school, like it felt like, I just felt like I was just kind of like going through the motions. Like it was just like really hard. And also because I was pretty, at least from my perspective, I was the only one out of like my close group of friends that had actually lost a significant person in their life. So I did feel pretty alone. Like I
Mhm.
felt pretty alone. Like of course, like my friends, at the time they would check in on me and say how I was doing, but at the same time, I also kind of felt like I had to put on this face of like, I have to be strong, pretend that I'm okay because like part of me, well, something that I've learned like in therapy is like, you don't have to like be strong all the time. It's okay to be vulnerable.
Mhm.
But at the time I was like, well, I'm just gonna say that I'm okay because I have to keep going. I have to finish high school, I have to go to college. Okay, so fast forward to me graduating high school. I was also the first out of like my friends to go to like a university, like straight out of high school. Most of my close friends chose different educational routes or career paths. So going to a university on my own was also something really like scary and daunting because I had no one else to talk to about it.
Mhm.
So I went to California State University of San Jose. So it's a state school. There's several out here in California, and it's relatively close to like my house. And I remember that first year just being really, really, really hard. Just like being in the environment of like, okay, you're like in college, learn like there's all these expectations, and just like navigating the system. It was really hard, but eventually, like I found like my groove. And then when I was 19, I started noticing that there were like my menstrual cycle was a little off, and I thought like, oh well, maybe it's because I'm stressed because again, I'm just getting through my first year of undergrad. Maybe it's because of that, or also during that time, because I didn't want to get any school loans for my undergrad, I was working like three jobs, like three part-time jobs. I had
Oh
like a
my
job,
goodness.
like I know I had like a part-time job on campus and then I had like two like retail jobs. So yeah,
Wow.
no wonder I was stressed because
No wonder you were stressed, right? I mean, and thinking, going back to, right, like 15, you were experiencing that loss, that grief, and it sounds like you were just going through the motions all throughout high school. Then you get into
mm-hmm,
college and you're still in go, 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 right? You're still in that sympathetic state of activation, right? It sounds like
mm-hmm,
you had been living in survival mode for a really long time. And
mm-hmm,
and this isn't something that we have to really go too much into detail about, but I'm also thinking about the how the loss of your grandmother could have potentially brought up grief from your dad, right? And not having your dad around, maybe
Mhm.
consciously or unconsciously, right? And here we are at 19, you're working three, four jobs, and now you're starting to notice there's something happening in your body.
Yes, yes. And it's so good that you highlighted that piece of like the grief of like my grandma and like my dad, because that's something that also that my therapist had pointed out, like when we first started working together, he was like, oh, I wonder if, these, and I'm like, I never thought of it that way, but you know what? I think you're right. And then all the tears started coming. So
Yeah,
I cry a lot
right.
in therapy, which is obviously absolutely fine.
Hmm.
But yeah, so a lot of grief. So okay, so going back to my menstrual cycle. So I just kind of, I was like, okay, well, let me see if I like the so during that time, it had been like 2 months that I hadn't gotten my period. And I also wasn't I wasn't dating. So there was absolutely no way that I could be pregnant. So finally, by the third month, when I still hadn't gotten my period, I was like, okay, I need to do something about this because this is not normal. So I remember going to like the health center like at school, and for some reason they said that I should probably go to like a main hospital. I guess because the clinic at the college is like really small, they don't have all the tools. So they just refer me to like a specialist or something like at a hospital. And I just remember just doing like a lot of like blood tests, and then and just when the doctor came back into the office, she was like, yeah, so the blood work came back, and it shows that you have PCOS, and that means that you're at risk for probably not having kids. And she started listing like all this information, and I'm just like, whoa, 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 what is PCOS? Like, how did this happen? Just like all this. So she broke down basically what polycystic ovarian syndrome is, what are some of like the signs. But I just remember like the one thing that she kept harping on that really like scarred me for a very, very long time was that, yeah, I don't know if you're going to be able to have kids because infertility is one of them. But, you're so young. It's not something that you have to worry about. But yeah, anyway, but like, yeah, that's pretty much it. I just remember thinking like, oh my God, like, what do you mean I might not be able to like to have kids? Not that having kids was on my mind like at that moment, but I was like, well, in the future, I would like
Hmm.
to. But I just remember just feeling like all kinds of like emotions. I was just like, oh my God, like this is a lot. Like what do I do with all this?
Right.
And
And she just kind
again,
of like dropped this bomb on you, and
yes,
it sounds like she said it so casually too.
yeah, like, oh, it's just this, and like, don't worry about it, you'll be
Oh my
fine.
goodness.
And I just remember actually like not even really talking about it to any of my closest for a very long time. Waiting for a lot of things, like what you said, being in survival mode, like, well, I mean, I don't have time to deal with this. I gotta keep going. I gotta graduate college. Let me keep moving. And then I remember when I finally did talk to like some of my close friends about it, like obviously they were like super supportive and like understanding, but it also did feel like, oh my gosh, like I'm glad that I'm finally talking about it, but it did still feel like I was carrying like this huge weight, like in my body, in my mind, like, oh my God, like what am I going to do with this information? Like when or if I decide to have kids, like that seems like scary. Um, so fast forward to oh, and I forgot to mention because of that diagnosis, I was put on birth control.
Mhm.
So I had been put on birth control. Yeah, so I was on birth control for a very long time because again, that was the recommended treatment at that time. But I just remember just like really like struggling like like emotionally because of that medical diagnosis, and just being like super careful as far as like, oh my gosh, like, I have to keep my stress level down, or I have to be mindful about like when I'm putting my body because I don't want to exacerbate the symptoms even more. I just remember just carrying like this big stress of this health diagnosis for like a long time, and just not knowing what to do with it, because when I did try to like we know when people would like ask me about it, I mean, I think people were nice. They were trying to be sympathetic and understand, but I feel like nobody really understands unless like you have the same diagnosis, if that makes sense.
Yeah,
So,
absolutely.
yeah.
Yeah, and I'm
Hmm.
curious to know because I had another guest on here, Lupe, who talked
Oh,
about
yeah,
her,
Lupe. Hmm.
yeah, about her PCOS diagnosis as well. And I know that she sort of refused to go the birth control route or the medication route. And she was like, I'm going
Hmm.
to find another way to treat this diagnosis. And so I'm curious to know if there was a point in your life where you were like, no, I think there's an alternative, or are you still struggling with the symptoms of PCOS? Tell us where you are now with that diagnosis.
Yes, yes, great question, Tati. So, okay, so I'm gonna how do I condense this? Because it's a lot. I've been through a lot.
Hmm.
Okay, so I was on birth control up until, let me see. So there was a period where I was actually off birth control. So I was on birth control from age 19 to up until when I graduated grad school, which was in 2008. So probably, gosh, I don't know, 26, 27. So not for too long, but long enough. But mainly because I was like, okay, I want to give my body like a little break and see how it does. And plus, I wasn't dating anyone like exclusively. So I was like, why not? Like, I'm not planning on dating. I'm going to focus on myself. So I remember, so I was off birth control for, so from age 26, 27 up until the time that I started, like, okay, I think I want to start finding my husband. So, so up until maybe age 33-ish, I would say it's when I went back. But I do remember that during that time of like not being on it, I actually felt pretty good, but I would say that my the cramping during my periods were absolutely horrendous. They were absolutely like awful. But other than that, like there wasn't anything like other significant like PCOS issues that came up. Like I know a lot of people mention um having like fluctuation in mood or like anxiety. I would say like that mood stuff only came up like during like my or like around my period, but I think PMS, so probably a result of that. Also one thing about like POS that I did struggle with when I got diagnosed with 19 is the weight gain. And I think that's something that happens to a lot of women. I just remember just like struggling with the weight gain, like nothing that I was doing was working. But when I got off the birth control, for some reason, it seemed to like come off, but also because that's when I started like my running journey. So yeah, it's just interesting how that works. So anyway, so I went back on it in yeah, when I was like 33-ish. However, that's also the time when another health issue presented itself. And then I'll touch on as to which led me to eventually get off the birth control pill. So when I was 33, I'm always been pretty good about going to like my annual like physical exam, just because of my PCOS. I'm like, okay, well, I guess I have to be more proactive and take care of myself. So I just remember going to my annual physical exam, and then my female doctor was like, I feel like a little like a small like nodule on your left breast. It could be nothing. It could be maybe just a cyst, but let's just have it checked out. And I was just like, oh my God, like, what do you mean? Like, all these thoughts came to mind, right? So I just remember her sending me to my very, very first mammogram. And I think at the time they were like, we don't think it's anything, but come back like so they did the mammogram and ultrasound. And I just remember being like, I think I was actually more scared about the ultrasound than the mammogram, mainly because the ultrasound is a little bit more like focused, and I just remember the technician just being focused on a certain area. I was like, oh my gosh, she sees something because she's been holding the machine for like 5 minutes. Well, that's what it felt like, but
Hmm.
they both. So basically, the result was that we'll check back like in 6 months, see how it is. So fast forward to 6 months, and then they did the test again. They did the mammogram again, an ultrasound. And then their recommendation was is that because it was still there, they recommended a biopsy. And I was like, oh my God, like, are they trying to tell me something, but not trying to tell me? Like, what's happening? So I did an ultrasound guided biopsy during that time. And for some reason, the sample that they got, like they couldn't get a definitive answer. So then my doctor was like, because of we couldn't get a definitive answer as a result of the biopsy, they're recommending like a small surgery. I was like, oh my God, this is a lot for a 33-year-old. Like, this is like a lot. But she was like, I'm sure everything's gonna be fine, but it's better, and bless her, like my doctor was super sweet and super supportive. She was like, it's better to let's just get it out, because whatever it is, let's get it out. So I just remember that year being, and oh, by the way, I think this was also maybe like the same year that I was studying for my licensure. So that's fantastic.
That's another layer of stress.
Yeah. So anyway, I ended up having the surgery. Luckily, the results were benign, but since that incident, they've had me do annual mammograms, sometimes ultrasounds. And I was fine for like 5 meetings. They hadn't found anything up until I turned almost 40, so like 39 and a half, when they noticed that on my right breast, they noticed what they call calcifications, meaning they're just like white dots that can sometimes mimic like cancerous cells, but they don't know like for sure because it looks very similar. So anyway, so I went back through the same circle. Like I did another biopsy, but this time it was a different one, and this one was definitely more uncomfortable. It was called the stereotactic biopsy. So meaning they use like a mammogram to do the biopsy. So your boob is like pressed in the machine, and then they put the sample. So not fun, but at least it's quicker than the other one. So fast forward, they said, it's benign, but as a precaution, we do recommend surgery. So I was like, but for some reason, when this happened, Tati, I wasn't, I don't know if it's because I was just like tired, or because like I kind of knew this was going to happen. I wasn't actually as scared or nervous as I was the first time around. Mainly because a part of me just felt like, this is what I have to, if this is what I have to do, like, okay, it's better to know now than years later. So luckily the surgery like went well, nothing else was found. Yeah, so I've still been on the path of like doing a mammogram every 6 months. Oh, but because of this new finding of the calcifications, they recommend breast MRI, which is also another not fun one, but it's supposed to be more accurate. But so now I've been on the regimen of the mammogram every 6 months and the breast MRI every 6 months. So I do both like every year. So this year is like my second year. No, yes, this year is my second year doing it. Yeah. So I remember. So going back to your birth control question, I remember asking like my doctor if these breast health issues are because of birth control, because I know I shouldn't go on Dr. Google, but I kind of did, because it was a very scary time for me. I was like, oh my God, like, how are these issues like still happening? And I know that even though I don't have any cancer history in my family, through my knowledge, I know that the number one risk factor is just unfortunately being female. Just being female is the number one risk factor. So I was doing my research. I had seen that there's been some articles that say that certain birth control pills not for sure, can possibly increase breast cancer down the line. So that's why I was like, okay, let me ask my doctor if maybe it's time for me to get off the birth control, because I just don't want to keep going through all this emotional roller coaster. And I just remember her being a little like my breast surgeon being like a little vague with the answer. But either way, I ended up deciding like, let me just try it like for however long and see how it goes. So from that experience, so I should know, as of this year, early this is when I got off the birth control pill and I started trying to do like a more holistic way of kind of healing my body, just from like all the grief, all the trauma that I've experienced. So I started doing also acupuncture, that I go every month or sometimes every 2 weeks if I can. And I also started doing lymphatic drainage massages, which
Mm.
are, oh my God,
Yes.
like life changing. So far I've been good. I had my breast MRI earlier this year. That came out good, and I'm back to my mammogram sometime next month. So hoping for good results. But yeah, so I feel like doing more holistic stuff has definitely I've seen definitely a lot of improvement in my well being. So
Hmm.
yeah.
Wow, what a
Yeah,
journey.
I know. I know
Yeah,
too. It was a long one.
absolutely. And I love that you've started a holistic journey, right? Because I mean, I'm a holistic coach and
Mm-hmm.
I truly believe that there's a pill for every symptom and also there's an alternative, a holistic alternative for every symptom, right? And I
Mm-hmm.
love that you've started to do the acupuncture and the lymphatic drainage massages. Those are amazing. I've had a lymphatic drainage massage just to try it out because I was curious about it. But for those of you who don't know about lymphatic drainage, like you can do this, you don't have to have a formal massage. There are so many different lymphatic drainage techniques that you can do every single day to kind of get that going, right? And if you don't know what your lymphatic system is, it's responsible for your immune system
Mm-hmm.
and releasing toxins. And so you know that you have a poor lymphatic system if you have inflammation or if you have like puffy or swollen body parts, if you have low
Mm-hmm.
energy. The list can go on with like the symptoms. And maybe I'll make another episode on lymphatic drainage and your lymphatic
Mm-hmm.
system because I think it's so important for people to really understand that piece of it. But anyway, I just love that you're doing that. And I'm curious to know, you've been through all of these things. It sounds like you've lived in survival mode for really a big part of your life, or maybe I should say the majority of your life, right? And I even think about like as first generation Latinas, right? Like
Mm-hmm.
we all have generational trauma, right? Like
Mm-hmm.
our parents and our ancestors have been through so much. Like, I think even if we had quote unquote the perfect childhood, right, we would still have
Mm-hmm.
that generational trauma. So I'm curious to know, like, where are you now, right, in terms of
Mm-hmm.
like your healing, not just your physical health and your medical health, but I'm curious to know about where you are emotionally, mentally, right? Like
Mm-hmm.
behaviorally. How do you feel now after kind of going through so much in your life?
Yes, thank you so much for also like breaking down like the importance of being knowledgeable about like your lymphatic system and the topic, because honestly, I had no idea how much of a game changer this was for me. And also I also want to highlight it's also really good to find a practitioner who is really knowledgeable about it. Because it took me a while to find someone who can really educate me, because I wanted, I shared with her like all like my health issues, and she was like, okay, slowly but surely we'll work on them. But yeah, so going back to your question, so as of right now, I actually went back to therapy really recently, only because there's just a lot of like moving pieces in my personal life. I'm trying to make the shift of going full time in my practice in the near future. And that's also bringing up a lot of emotions, because it's a big shift. And then my partner and I are talking about like really settling down and like building like a home somewhere. So that's also bringing up a lot of emotions. Not because like I'm scared to do it, but it's also because it's a big shift. And what I'm learning like in my therapy is that throughout my life, like I've been through like so many like changes and I've never really had the time to actually sit with the emotions. So it started to kind of accumulate over the years. So now my goal for this year is to actually like go through emotion, go through the feelings, go through the emotion, and not run away from them anymore. Because running, oh, I can't do that anymore. Like I can't. I
Mhm.
have to feel the feelings. That's what he tells me.
Yes.
Um, and my therapist is great. So I actually, I thought I decided to go with someone who he's a person of color, which I love. And the approach that he uses, it's a little bit like a combo of holistic, a little bit theoretical, but just the way that he kind of like helps me like break down stuff. It's more of a way of like learning to be gentle with yourself so that you could slowly get off survival mode, which is something that we talk about
Mhm.
a lot like in session. It's like, you could keep going in survival mode like if you want to, but like at the end of the line it's possibly like more burnout, possibly more health issues, or you could start making small changes now and get off the survival mode train. It's
Mhm.
kind of up to you. So when he presented it like that, I was like, oh, yeah, okay. So I want to get off the survival mode train because I've been on it
1000%.
for a very long time. Yeah, I've been on this for
Yeah.
a long time. So I would say this year so far has been one of the most healing and transformative years, Tati. And I think little Carla would be so proud of like all the growth and nourishment that she's done for herself.
Oh my
Mhm.
gosh, I love
Mhm.
that so much. And
Mhm.
I would love to hear maybe your biggest shift that you've noticed in yourself since starting your healing journey. What's the number one thing that you're like, you know what, little Carla would be proud of of this piece?
Yeah. I would say, oh, there's a couple. I would say like not feeling guilty for like setting boundaries. It's like when I know that that's something that I really struggle with like for like a long time, which is something that I see a lot like in the clients that I work with as far as like, what will people think of me, or like I'm scared of the reaction about other people. But at the end of the day, like I'm recognizing, setting a boundary is just a way for me to still preserve the relationship. At the end of the day, the relationship with myself is the most important out of everything else, because if I don't take care of me, then there's everyone else will kind of not get their full representation of me in a sense.
Mhm.
So
Yeah.
setting the boundaries, not feeling guilty for taking, like a mental health day or like a sick day. I know that's something that I've always struggled with, even like when I was like in school. But just recognizing that sometimes like you just need like a day to just recoup, like
Mhm.
relax and just kind of like recharge. And also something that my therapist has pointed out is that I'm doing a better job about being vulnerable with others. Like I'm really good about people like telling me like all their things, but when it comes to me, it was the thing that I talked about like from earlier, like, oh, like this happened, but I'm fine. Let's talk
Uh-huh.
about something else,
Yeah.
But so leaning into the vulnerability has definitely deepened my relationship in such a powerful way that I could not have imagined it
Mhm.
anymore. And it does feel good to like release that part of me, because for so long I was just like, no one's getting in, no one's
Yeah.
getting, or even like a little bit, but then I'll close the door, a little bit, but I'll close the door.
1000%. Oh my gosh. Carla, I can totally relate to that. And I I think that it's very common, kind of going back to what you were saying earlier, right? Like in the Hispanic community, right? Like we don't talk about grief, but we also don't
Mhm,
talk about emotions kind of in general, right? Like we don't talk about
mhm,
mental health. It's not, I think now it's, things are starting to change. The conversation is
mhm,
starting to be opened, right? But I think when it goes back to like how we grew up and our parents, right? Like we don't talk about emotions, like get it together, right? Like we're just gonna
mhm,
keep moving forward. And I can totally relate to you in terms of like the vulnerability piece. I think
mhm,
that's definitely a muscle that I've had to grow. And similar to you, I think as therapists, it's so
mhm,
easy for us to be the listeners and have people tell us the stories. And we're very good at holding space for others. But when it
mhm.
comes to us opening up, it's like, ooh, no, I'm not ready for that. Right. And
Oh,
right.
yeah,
And it's definitely something that I've had to practice as well. And even like on the podcast, it's given me the opportunity to do that. But
yeah.
also it's so amazing how once you start to open up and really tap into that vulnerability, how much
Mhm,
support you get from that, right? Whether it's from family or friends or just like people on the internet, right? Like I know I've
mhm,
shared a few things here and there on social media, and like the amount of support that people are just ready to give you is really wholesome. And I love that you're getting a chance to feel and experience that too as you practice opening up and being more vulnerable.
Yeah, yeah, and I would say that's probably like one of the biggest like game changers in my romantic relationship. And my partner, oh, he's so patient with me. Like yeah, like you said, like we're really good about holding space like for other people. But like something that that I struggle with. Well, I think for two reasons, right? Like just working through the the my father wound, right? Like and the grief about that, and also like working through the mentality of like, well, I don't want to give like him too much because I have to hold it on my own, but just in case things work out. But I think obviously we've been together for a very, very long time. Like over the years, he's shown me that he is someone that is gonna be there for me. He's gonna show up for me. He's gonna love me like no matter what. So basically, like, all the things that I didn't like have like in my father. So with him showing this consistency has led me to more vulnerability, more openness, and yeah, it's definitely been a really big game changer for our relationship.
I love that. It sounds like a really safe and healthy relationship.
Yes,
I
yes,
love
it has
that.
been.
Carla, thank you so much for sharing a little bit of your story with us. I know that there will be so many women who can relate to you, and tell the audience where they can find you if they want to continue to connect with you.
Yes, so you can find me on Instagram under Nuevos Caminos Therapy. I am not on TikTok. I feel like I only have space like for Instagram. So you can find me on Instagram. And I have a bunch of like resources on my page. I always really good about like helping the community get connected to like free resources or support groups. So I definitely have a lot of stuff on my page if you guys like want to like check it out. But yeah, you can find me on Instagram.
I love it. Thank you so much,
Uh,
Carla.
Thank you for having me.
Thank you so much for joining me today. If you absolutely loved this episode, I would so appreciate it if you subscribed and left a review on Apple Podcast, or take a screenshot and share this episode on social media. Don't forget to tag me at tatiana.holistic.coach. The more nervous systems we reach, the more generational cycles we break, and the more we contribute to a kinder and safer world. And if you're looking for somatic healing services, send me a DM and I'd love to chat on how I can support you. I'll see you in the next episode.